Social welfare and social work. Disclaimer. The information presented in this material is intended for educational purposes only and is based on available resources, laws, and professional standards at the time of preparation. While every effort has been made to ensure accuracy, the content may not cover all possible situations or reflect the most current developments in the field of social work. This presentation is not a substitute for professional advice, guidance, or official documentation. Users are encouraged to consult relevant authorities, official sources, or licensed social work professionals for specific concerns or decisions. Table of Content 1. Social welfare, social services and social work. 2. The development of social welfare in the Philippines. 3. The social work profession. Social welfare refers to the organized system of programs, policies, and initiatives designed to improve the well-being of individuals, families, and communities. It focuses on meeting basic needs such as food, shelter, healthcare, and education, while promoting fairness and reducing social inequalities. Example: imagine a community where many families struggle to afford nutritious food. A social welfare program might provide food assistance or community kitchens to ensure everyone has access to healthy meals. Social services are the practical programs and support provided to individuals or groups to help them cope with life challenges. These services often include counseling, healthcare access, child protection, rehabilitation, and support for the elderly or disabled. They are the hands-on part of social welfare. Example: a single mother struggling to balance work and childcare might receive social services such as access to affordable daycare, parenting workshops, and counseling support. Social work is a professional practice that helps individuals, families, and communities improve their well-being and navigate difficult life circumstances. Social workers assess needs, provide direct support, advocate for clients' rights, and work to address social problems at both personal and systemic levels. It combines empathy, knowledge, and advocacy to create meaningful change. Example: a social worker in a hospital setting might help a patient recently diagnosed with a chronic illness access financial support, connect with counseling services, and coordinate care with healthcare providers, ensuring both emotional and practical needs are met. The development of social welfare in the Philippines. Social welfare in the Philippines has evolved over centuries, shaped by culture, history, and the growing needs of its people. From informal support systems in early societies to today's organized and professional services, this development reflects the country's commitment to caring for its citizens. Prehistoric period. Before formal government structures existed, Filipino communities relied on strong kinship and communal support. Families and barangays or villages shared resources, provided mutual aid, and cared for the elderly, children, and the sick. Social welfare was an informal practice rooted in empathy, shared responsibility, and cultural values. Spanish colonial period from 1521 to 1898. During Spanish rule, welfare was largely influenced by the Catholic Church. Religious institutions provided charitable works such as orphanages, hospitals, and schools for the poor. Social welfare was more charitable than systematic, focusing on moral and spiritual guidance alongside basic care. American colonial period from 1898 to 1946. The American regime introduced more formal structures, focusing on public health, education, and social hygiene. Social services began to be seen as a responsibility of the government, laying the groundwork for professional social work practices. Post-war period and early republic from 1946 to 1970s. After World War II, the Philippines faced widespread poverty and social disruption. Social welfare programs expanded, including services for war veterans, displaced families, and children in need. Government agencies began to formalize social work practice, training professionals to respond to complex social problems. 1980s to 2000s. The social welfare system grew more organized, with legislation supporting the welfare of children, women, elderly, and marginalized communities. Programs like the Department of Social Welfare and Development were strengthened to provide relief, rehabilitation, and development programs. Social workers became essential in bridging the gap between government policies and community needs. 2010s to 2024. Today, social welfare in the Philippines is a vast and organized system of services addressing diverse human needs, from disaster response to mental health, poverty alleviation, and protection of vulnerable groups. Social workers, non-government organizations, and government agencies collaborate to ensure holistic care and social justice. Social welfare now combines preventive, curative, and developmental approaches, responding to the complexity of modern society. Real-life example. During a typhoon in 2023, a social worker in Leyte coordinated relief efforts for affected families. They ensured immediate shelter, food, and medical assistance while also helping families access government compensation programs. This is a modern example of how social welfare in the Philippines operates as a structured, responsive system addressing urgent and long-term human needs. The social work profession is a helping profession dedicated to supporting individuals, families, and communities to overcome life's challenges and improve their well-being. Social workers serve as advocates, counselors, and facilitators, guiding people through difficulties such as poverty, family problems, mental health issues, and social injustices. In a social work setting, the profession is more than just a job. It's a commitment to understanding people, listening to their stories, and empowering them to make positive changes in their lives. Filipino social workers often work in hospitals, schools, government agencies, non-government organizations, and community centers, addressing both personal and societal issues. A core aspect of social work in the Philippines is the focus on human dignity and social justice, meaning that social workers not only help people cope with immediate problems but also strive to improve systems and policies that affect marginalized communities. Example: imagine a single mother struggling to provide for her children while dealing with emotional stress. A social worker may connect her to financial assistance programs, provide counseling, and help her build skills or resources to become more independent. Beyond solving immediate problems, the social worker helps her regain confidence, resilience, and hope. In essence, the social work profession in the Philippines is about walking with people through life's challenges, advocating for fairness, and helping communities thrive. Thank you.